Did you know that over 60% of stroke victims never see it coming? What if I told you there are 15 unusual signs that could save your life? These silent killers are lurking in plain sight, and missing them could be fatal. Stick around, because what you're about to learn might just save your life. Hey everyone, welcome back to our channel. If you're new here, make sure to hit that subscribe button and turn on notifications so you never miss out on life-saving information. Today, we're diving into a crucial topic that every man needs to know about. The 15 unusual stroke signs you should never ignore. Let's get into it. Strokes are the fifth leading cause of death for men, and the numbers are rising. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. While most people are familiar with common stroke symptoms like sudden numbness or trouble speaking, there are many lesser-known signs that are just as critical to recognize. Understanding these unusual signs can make a significant difference in the outcome for you or a loved one. Time is of the essence when it comes to stroke, and every second counts. Recognizing the warning signs early can lead to quicker treatment, reducing the risk of long-term disability, even death. Now, let's delve into these 15 unusual stroke signs. The 15 unusual stroke signs. 1. Sudden vision problems. Imagine waking up one morning and suddenly your vision is blurred or doubled. It's not just a minor inconvenience, it's a potential life-threatening emergency. Sudden vision problems in one or both eyes can be an alarming indicator of a stroke. This happens when a stroke affects the part of your brain responsible for vision. Ignoring this sign could lead to permanent vision loss or even death. If you or someone you know experiences this, don't hesitate, seek immediate medical attention. 2. Unexpected severe headache. Picture this, you're going about your day when out of nowhere, you're hit with the most excruciating headache you've ever experienced. This isn't your typical headache, it's sudden and severe, often described as thunderclap pain. Such headaches can be a sign of a hemorrhagic stroke, where a blood vessel bursts in the brain. This type of stroke can quickly lead to severe brain damage or death if not treated immediately. Never brush off a severe headache, get to the ER fast. 3. Dizziness or vertigo. Imagine feeling like the world is spinning uncontrollably around you. Sudden dizziness or vertigo, especially when accompanied by other symptoms like nausea or imbalance, can be a terrifying sign of a stroke. This occurs when blood flow to the brain is disrupted, affecting the inner ear and balance centers. It's easy to dismiss dizziness as a minor issue, but in the context of a stroke, it's a red flag that demands immediate medical attention. 4. Unexplained fatigue. Picture this, you're suddenly overcome with extreme fatigue, the kind that makes it impossible to keep your eyes open or concentrate. This isn't your usual tiredness, it's a deep, unexplained exhaustion that can be a precursor to a stroke. When the brain doesn't get enough blood flow, it can lead to severe fatigue, making it hard to function. Don't ignore this warning sign, your body is telling you something is seriously wrong. 5. Sudden confusion or trouble understanding. Imagine trying to have a conversation and suddenly, you can't make sense of the words being spoken. Sudden confusion or trouble understanding speech can be an alarming sign of a stroke. This occurs when a stroke impacts the areas of the brain responsible for language processing. It's not just disorienting, it's a critical warning that immediate medical intervention is needed to prevent permanent damage or death. 6. Loss of balance or coordination. Picture yourself walking across the room when suddenly, you lose your balance and coordination. It's not just a stumble, it's a complete inability to control your movements. Sudden loss of balance or coordination can be a frightening sign of a stroke affecting the cerebellum, the part of the brain that controls movement. Don't dismiss it as clumsiness, get medical help immediately to avoid severe consequences. 7. Difficulty swallowing. Imagine trying to swallow and feeling like there's something stuck in your throat. Sudden difficulty swallowing, or dysphagia, can be a sign of a stroke impacting the brainstem, which controls the muscles involved in swallowing. This is more than just an inconvenience, it's a serious symptom that could lead to choking or aspiration pneumonia. If you experience this, seek medical attention right away. 8. Numbness or weakness in the face. Imagine looking in the mirror, noticing one side of your face is drooping, or you suddenly feel numbness in your cheek. Numbness or weakness in the face, especially on one side, is a classic and alarming sign of a stroke. This occurs when blood flow to the part of the brain controlling facial muscles is blocked. It's a visual and physical cue that something is dangerously wrong. Don't hesitate, call emergency services immediately. 9. Arm or leg weakness. Picture this: you go to pick up an object or take a step, and one of your limbs feels completely weak or numb. Sudden weakness or numbness in one arm or leg, particularly on one side of the body, is a common but critical sign of a stroke. This occurs when a stroke affects the motor cortex, the area of the brain responsible for muscle control. Ignoring this can lead to permanent disability. Act fast and get to the hospital. 10. Hiccups. Imagine being hit with a bout of hiccups that just won't go away, no matter what you do. Persistent or sudden hiccups, especially when combined with chest pain or other stroke symptoms, can be an unusual but serious sign of a stroke. This can happen if the stroke affects the part of the brain that controls breathing and diaphragm function. While it may seem trivial, persistent hiccups can be a warning sign, don't ignore it. 11. Shortness of breath. Picture struggling to catch your breath, feeling like you've just run a marathon even though you've been sitting still. Sudden shortness of breath or difficulty breathing without a clear cause can indicate a stroke, especially if it's affecting the brainstem, which controls vital functions like breathing. This isn't just discomfort, it's a dire warning that immediate medical intervention is needed. 12. Chest pain. Imagine experiencing sudden chest pain that radiates through your body. While commonly associated with heart attacks, sudden chest pain can also be a sign of a stroke, particularly in men. This could be due to a stroke affecting the part of the brain that manages cardiac functions. It's crucial not to dismiss chest pain as just heartburn or anxiety, get it checked out immediately. 13. Rapid heartbeat. Picture your heart racing out of nowhere, pounding so hard you can feel it in your chest and neck. A sudden, unexplained rapid heartbeat can indicate a stroke or other cardiovascular issues, particularly if accompanied by other stroke symptoms. This happens when the brain's autonomic functions are disrupted. Don't ignore a racing heart, it could be a warning sign of an imminent stroke. 14. Loss of consciousness. Imagine suddenly blacking out without warning. A sudden loss of consciousness or fainting can be a frightening sign of a stroke, especially if it occurs with other symptoms. This can happen when a stroke severely disrupts blood flow to critical areas of the brain. It's not just a fainting spell, it's an urgent medical emergency that requires immediate attention. 15. Changes in personality or mood. Picture your mood swinging wildly from calm to irritable, or feeling unusually anxious for no apparent reason. Sudden, unexplained changes in personality or mood can sometimes indicate a stroke, particularly if it affects the brain regions involved in emotion regulation. It's easy to dismiss mood changes, but in the context of a stroke, they're a critical red flag. Pay attention and seek help immediately. Recognizing these unusual stroke signs can be the difference between life and death. If you or someone you know experiences any of these symptoms, seek medical attention immediately. Don't wait, every second counts. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe and hit the notification bell so you never miss out on vital health information. Stay safe, and take care of yourself and your loved ones. Thanks for watching.